Chapter 23, Part 2. The objectives are the common procedures related to the gastrointestinal system and gastric-related procedures. Endoscopy is an outpatient procedure when the patient is under sedation. In all cases, physiological monitoring includes cardiac, oxygen, respiratory, blood pressure, and a level of consciousness are monitored. Endoscopy is not usually painful, but sometimes uncomfortable. Preparation depends on the location of the procedure. Upper GI procedures require limitations on oral intake, and lower GI procedures require dietary restrictions and an enema, which the patient does the day before surgery. The purpose of the procedure is to establish or confirm a diagnosis by direct visualization and biopsy, to allow postoperative inspection of the surgical site from inside the lumen of the GI tract, and for screening. An EGD and esophagoduodenoscopy is an endoscopy of the esophagus, stomach, and proximal duodenum. The goal of the procedure is direct diagnostic observation of inside the esophagus and duodenum, with biopsy, treatment of varices, sclerotherapy, polyp removal, placement of stent for esophageal stricture, and endoscopic gastronomy for insertion of feeding tubes. Before the procedure, the scrub check will make sure that the camera and video equipment work. The scope itself should suck, spit, and blow. This is tested in water. Once the patient is sedated and placed in a lateral position, a small amount of gel is placed on the tip of the camera and inserted into the mouth. The camera is advanced slowly to examine tissue as it passes by. If biopsies are taken, the scrub passes items needed for the biopsy to the surgeon. The biopsy instrument is inserted through an instrument port on the camera. Care should be taken when receiving the specimen. The tip of the biopsy retriever is usually swished in water or saline. Post-procedure considerations include monitoring the patient for gag reflex, pain, and ensuring complete recovery from sedation. The patient is taken to PACU or a designated area for observation before getting discharged home. Colonoscopies is an endoscopy of the large intestine. The purpose of the procedure is to remove polyps, perform a biopsy, and remove lesions, laser treatment of small tumors, and routine screening for colon cancer. Colonoscopies require sedation of the patient. It can be both embarrassing and uncomfortable for the patient. The patient is usually in the left lateral position and should be covered with warm blankets, with only the backside exposed. The scope is lubricated with gel and inserted slowly into the anus. Once the proximal colon is in view, the doctor will begin to withdraw the scope while examining the mucosa. Air may be pumped into the colon, which may cause the patient some discomfort. Photos are taken of any suspicious tissue, and suction and irrigation is controlled at the scope head. Cupped or brushed biopsy forceps are guided through the scope, and as the tissue is removed, the scrub tech will help control the tip of the forceps. It's flimsy, so you don't want to lose a specimen. Post-op, the patient is monitored for pain, bleeding, and sensitivity to any medication given during the procedure. A sigmoidoscopy is performed to examine tissue or obtain biopsy specimen of the sigmoid colon and rectum. The patient is in the prone or lithotomy position, and the scope is inserted. Laparotomy is open surgery of the abdominal cavity for access of the abdominal organs. It is performed to confirm a diagnosis or detect a specific pathological condition called an exploratory laparotomy. An esophageal diverculum is also called a Zinker diverculum. is when the mucosa and submucosa herniated through the cricopharyngeal muscles. It usually happens in people 60 and over and causes food to be temporarily trapped. A Nissen fundoplication is used to treat GERD, the gastroesophageal reflux disease. The upper part of the stomach is wrapped around the esophagus below the hiatus to act as a sphincter. This prevents backflow of the stomach contents into the esophagus. The gastric contents are usually prevented from entering the esophagus by the lower esophageal sphincter, and loss of pressure in the lower esophageal sphincter allows the highly acidic stomach contents to wash into the esophagus, causing erosion. GERD causes pain, respiratory irritation, and can lead to esophageal cancer. It is usually performed laparoscopically. A vagotomy is performed to reduce gastric enzymes by severing the nerves that control the release. The nerve branches over the stomach. Selective disruption of the nerve has been used to control the release of stomach acid and to treat peptic ulcer disease. The procedure is normally performed in conjunction with a gastric resection. It is being studied as a way to treat obesity. Early studies show an 18% weight loss. A percutaneous endoscopic gastrostomy, or PEG, is a common method of providing access to the stomach through a flexible tube inserted through the abdominal wall. The tube is intended for feeding patients who are unable to eat normally because of disease or trauma. A partial gastrectomy, Billroth 1 and 2, is when the diseased portion of the stomach is removed. The remaining portion is anamose to the duodenum or jejunum. A partial gastrectomy requires reconstruction of the stomach to maintain continuity of the GI tract. It depends on the location and extent of the pathology, patient's age, and overall condition. The gastric pouch can be attached to the small intestine, or the divided end of the intestines can be attached directly to the stomach. The difference between the Billroth 1 and 2 are where the intestinal clamps are placed. In Billroth 1, the clamp is placed across the duodenum, and in Billroth 2, the clamp is placed across the jejunum. Laparoscopic bands are performed for the treatment of morbid obesity. Nutritional intake is restricted by creating a small pouch in the proximal stomach. That food passes slowly into the pouch and creating the feeling of fullness. This is why people say eat slower, you won't eat as much. The pouch is created by encircling the upper stomach with an inflatable tube. Tension on the band is adjusted by adding or removing saline and regulating the flow of food out of the pouch and into the stomach. The most common is the lap band. They're not used as much now. Gastric sleeves and gastric bypasses are more common. The Roux-en-Y gastric bypass is performed to bypass the distal stomach and reestablish continuity from the stomach to the jejunum. A large portion of the stomach is bypassed and a gastric pouch is created. The anastomosis between the pouch and the jejunum reduces the amount of food absorbed by the body. Morbid obesity is a condition in which a patient's BMI is at least 40. The BMI ratio of weight and height is calculated by a specific formula, weight in pounds by height. Approximately 40,000 people die annually as a result of obesity in the U.S., and it contributes to cardiovascular disease, breast and large intestine cancer, diabetes, stroke, depression, and incontinence. Prospective patients are screened and usually require an attempt to lose weight. Criteria for surgery include motivation to lose weight, stop smoking and drinking, and remove yourself from any factor that could hinder a successful weight loss. Some precautions that you want to take into consideration are: can the OR table accommodate the patient? Most bariatric tables can hold up to 800 pounds. And do you have the necessary table attachments? A lot of times the patient is in reverse Trendelenburg. Resection of the small intestine is performed to treat an obstruction, disease, or cancer. Intestinal obstruction is a general term that encompasses pathological conditions that block the intestine and require immediate surgery. Obstruction can lead to perforation, necrosis, and peritonitis. The most common are strangulation of the bowel due to hernia, volvus, twisting of the bowel, intussusception, telescoping of the bowel, which is mainly seen in children. Diverticulum occurs at the distal ileum. It is a condition that arises from a congenital remnant of the umbilical duct. Resection of the colon is where the section of the large colon is removed and the remaining portion is restored by anastomosis or brought to the outside of the body called a colostomy. An ostomy is where the portion of the large intestine is divided and the open part is brought out to the skin, draining the contents of the bowel outside of the body. This opening is called a stoma. An ostomy pouch is used to collect the intestinal fluid, and this is called a stoma appliance. The patient drains the bag as needed. The appliance fits tightly over the stoma and contours to the body to prevent leaks and try to keep the smell in. The small intestine stoma is called ileostomy. A large intestine stoma is called a colostomy. A colostomy is performed to give a bowel break after a colon resection. It is a reversible surgery. A colectomy is a general term for removal of the large intestine. It can refer to the complete removal or partial section. Surgical goal is to remove the damaged or diseased part and restore its continuity by anastomosis. This is done for treatment of cancer, ulcers, or perforation. It can be repaired using the same methods with the small intestine. In an abdominal peritoneal resection, the anus, rectum, and sigmoid colon are removed for the treatment of cancer. It is done through 2 incisions, an abdominal to remove the colon and a perineal to remove the anus and rectum. Appendectomy is removal of the appendix. This is done for preventative measures or if the appendix perforated. This can be done open or laparoscopic. Hemorrhoids are removed for pain management purposes. What happens is the venous plexus of the anal canal may become congested or distended and prolapse outside of the anal canal. A pylondocyst is a congenital defect where the epithelial tissues develop below the surface of the skin in the area of the sacrum or coccyx. The anorectal fistula is a tract or tunnel that forms in normal or infected tissue. It remains open due to drainage or pus because the tissue lining does not have the cells needed to heal it.